So from a very young age, I was actually always interested in helping people. Growing up as this kid, I was really, I appeared shy, so I felt like I couldn't really speak about any of my emotions. You take those emotions and it gets stored in your body in all sorts of different places. The less that you deal with those things, the more likely you're going to suffer from a chronic illness. And suppressed emotions are a huge part, I believe, of cancer and what causes cancer. Anybody with a chronic illness where they are like just constantly dwelling in on that chronic illness, and that's almost becomes their identification. Well, if you're not going to really do anything about it, you can't, that's not taking any accountability to change anything. That's basically the indoctrination of everything that we're living right now and how we're living right now. Basically it is their power and control so that they can rule over everybody else, and we are just like minions, and then keeping us in that state so that we don't become aware of what's going on around us or what's happening. It's all right there in front of us, but they've done such a good job of hiding the truth that it's almost impossible to find. If you separate families and continue to separate families, you're going to drive people to be easier brainwashed into whatever you want them to think. People are needlessly suffering. People are needlessly having a terrible quality of life, needlessly going through treatments that are probably not going to benefit them and losing their lives. It was like my eyes were open to this whole other world. Like there's all these other people out there that have this greater understanding of how our bodies work and how holistic modalities can help us survive, help us live, help us to live better lives, and not even just through cancer, but with anything.
The following podcast is for educational purposes only and contains material that may not be suited for sensitive audience members. Audience discretion is advised. Welcome to another episode of the Health King's Court, ancient wisdom for modern health. Today I have a very interesting guest with a diverse background in the medical and health world. She was a registered nurse, a holistic pain management committee leader, and a member of the American Society for Pain Management Nursing. She's a member of the Holistic Nurses Association and the American Cannabis Nurses Association. She's a home health and hospice nurse for 3 years. Worked in neurology, family practice, and urology. She precepted in oncology for nursing school. She's also worked as in the medical surgeon region of the hospital during COVID. She's a co-wellness coach for 5 years at a coal mine. Fascinating. And last but certainly not least, a certified holistic cancer coach with the beatcancer.org certification program. That is Marinette Smith. Marinette, welcome to the show.
Thank you so much, Zach. Thanks for having me on today.
Thank you for joining me. I'm glad we got all our technical things sorted out, and it's going to happen as it was meant to. Mm-hmm. So right in that intro right there was a lot of very fascinating parts, from the coal mine to the hospital to like 5 different kinds of nurse. Let's start from the very beginning though. And what got you interested in being in this broad field of health and wellness overall? Was that always a passion of yours to be some sort of healer or helper in that way? Or did you just find your way into the industry? What brought you to be in the area you are now?
So from a very young age, I was actually always interested in helping people. When I decided actually that I wanted to be a nurse, I wanted to help people, is I was on a playground and we were kids and we were playing, and there was a child that had broken a leg and the bone was literally like sticking out of the leg. And I wasn't concerned about any of that. Like I was just making sure that kid was okay. So, from that point on, I knew that I wanted to be a helper. Like I wanted to be able to help calm people in situations, especially if it's something that's traumatic or something that they're stressful going through. So from there, it piqued my interest. And so my mom she just fed that interest over time. And when I really started getting more interested in it is I started having my own health issues from a very young age. At the age of 8, I started losing my hair. I would have constant digestive issues. I'd have seizures that were unexplainable. I'd have all these things off and on, and nobody could really actually ever tell me what they were. And so I pretty much became my own advocate for myself, and so did my mother. And so we started digging deep. I want to say for one of my birthdays, at 13th or 14th birthday, my mom got me an aromatherapy book, and I just started reading and consuming all of it. And it just opened my eyes that there was so much more. Even as a teenager, I was able to see that. And I was just fascinated with the fact that there was, all these other things that could help you that we'd find in nature. And so I think part of it is just innately in who I am. I come from a family of caregivers. And so I think that that's also part of it. But like I said, I was on my own health journey of trying to figure things out. And then, as I would talk to people throughout my life, I would notice that they would also have issues that they just couldn't figure it out. And they would try to find certain things and try to find different answers, and they couldn't really ever find one. And so it really became a passion and a mission for me to be able to help people as much as I could. And so, yeah, that was part of it. And then I want to say I was around 22. I started becoming very, very ill to the point where I couldn't work. I was actually in college. I couldn't finish college and I had to move home. And they initially had thought that I had MS. And eventually they diagnosed it with fibromyalgia. Then later on down the road, I was actually diagnosed with celiac disease. So the celiac disease was causing all these health issues throughout my whole life. And so then I became even more interested in finding out, digging deeper into, different things that they don't normally see, like the rare diagnoses, because at that point in time, people didn't really have an idea of what celiac disease was. And so then that also led later on to me having stage 2C colon cancer at the age of 32. I was diagnosed when I was 32. So I just continued to have all these health issues. And so I would also find other people that I was alongside with going through all these things too. And they were in the same situation. Like, how do we fix this? How do we get out of this? How can we help ourselves? How can we help each other? And so it just became a huge, deep passion for me. And then once I got into the cancer world, I started seeing that there were so many things, and so much information and education that people just did not have in general. And so that became my driving force to be able to focus on that. Now, as far as pain management, because of the celiac disease, I was very, very focused on being able to try to manage my pain without medications. Because that's all. I go to the doctor and they would give me this or they give me that. Thankfully, I had one neurologist who was amazing. And he's like, I think that there's something more going on here. I don't think it's just neurological. I don't think it's just anything else. And that's what led to my celiac disease diagnosis, is he found the gut connection to the pain that I was experiencing. And for me, that was so mind-blowing, because I'm like, you hear people say, oh, it's in your head. To an extent, it can be. But now we know that there is a connection between the gut and the brain and pain and inflammation. And so, having that other outside perspective really just opened my eyes. And then, noticing too that people just really don't have an understanding just in general of different causes of pain, their different root causes. I became extremely involved in patient advocating for pain and pain management. I, as a nurse, would see people go through things that, they were just suffering, and you couldn't just keep putting a Band-Aid on it. And I felt like a lot of times they were just DIYing their healthcare. So they were trying to find this, they're trying to find that. And so that's when I got really involved in holistic nursing and the pain management nursing as well. And I became a part of a committee at the hospital that I was working at. And that just opened my eyes and was a whole new world too. So I was very, very thankful for that experience. But like becoming an advocate for those that are just suffering and trying to help them to see that there's hope. There is hope in all of this. Sometimes it takes a long time. A lot of things that we deal with is chronic, and it does take a long time for those things to start developing. So it takes a little bit longer for it to start healing. And some things that people deal with on a chronic level happen acutely from surgery or an accident or whatever. And those pain issues are also a little bit different to address too. So, so that's how I got involved with all of these different aspects. I got into the oncology nursing because went through cancer. I want to be able to help support other cancer patients. I went on to home health and hospice because that's really where my heart was. I could spend more time with the patients, and then I could help them manage their care. I could help them manage their health. So it's kind of like a case management that I was doing with that. And then I wanted to go on and become a nurse practitioner. So I went into clinical studying and because I wanted to make sure that that's actually what I wanted to do. And that's how I got into neurology, family practice, and urology. And then when COVID happened, it's just kind of like all hands on deck. You just fill in what you need to. So that's how I got involved in that too. So I was actually very fortunate and blessed that I lived in a rural area. So I was able to work in many different sections of the healthcare field and nursing. And so that was a pretty big blessing.
And so, for someone that got their beginnings in the health and wellness arena, in the holistic side of things, being perhaps that aromatherapy book as your first, and now is also very much focused on the holistic side of things with, the holistic cancer coach certification. And I know what your mindset is now. How did it feel in that in between phase where you were going into conventional nursing before you kind of found your niche on the holistic side of things? Were you very accepting, and did you very much enjoy the conventional modern philosophies that you observed in nursing? Did it always kind of feel not so right, but you just didn't know what to do otherwise? What was the experience like in that way?
It was exactly like the last one that you had just mentioned. I felt like, we were helping people, but we weren't fully helping them to the extent that we possibly could. There was so much more we could do. And we would do things in the conventional manner, but I'd always just feel like there was just more to it. And sometimes it didn't feel exactly right. That's actually why I didn't go into oncology nursing and infusion nursing. That's a whole nother topic. But as I was getting more and more into my practice, my eyes were actually starting to open a lot more. There were times that I was more on the conventional side, and I don't know if that's more like the training. They train us in a certain way to think a certain direction. And so you go along those certain lines, but you also have to have your critical thinking. And that's where it really comes into play, is you have to have your critical thinking. And so once you start using that, you start seeing that there is so much more that we can be doing. And a lot of it is for times constricted in healthcare. I mean, you only are allowed so much time with a patient, so you don't really get to dive deeper into all of those things. Truly, probably most people should have a case manager or a chronic care manager when they're going through healthcare situations and in the healthcare field. And so, I just always kind of felt like that was just a little off. And so when I joined the Holistic Nurses Association, I was just like, I could breathe. I found my people. I could like, oh my gosh, there are certain things that we can do. There are certain modalities that we can implement into their care. And, we don't have to just continually follow that conventional model. So there was this whole other section of us that did see outside and see that, maybe the direction that we're going is probably not, the greatest way to handle things. A lot of us were more like, what's the root cause? Like, what's causing a lot of these issues? How can we help people address them? How can we help people manage them? And I think that is a huge piece, is helping people to see that there is that hope. The conventional model doesn't really do that. They treat sick, or they treat like the injury or the illness acutely. Like, that's just the way it goes. But when you're trying to adjust things in a long-term management, that's when you really start to see that, there's a bit more of what we can do here. And I guess also too, like going through cancer myself, I had to dig through research and books. And I mean, I pretty much had to do it all on my own. Again, like another DIY situation of my own healthcare. And so experiencing that as a patient and at the same time as a nurse, I could see where there were so many gaps in the healthcare field. And so that's actually what led me onto the road of becoming a certified holistic cancer coach.
That's awesome. And so, before you found the Holistic Nurses Association, would you say it was like most of your peers that also were on that same wavelength of view of like this isn't quite right, or was that very uncommon? Were most very kind of conventional, mind washed? Well, I guess.
Yes, they don't tend to think a lot of the same ways that those of us that are in that holistic mindset think. I was blessed to be able to work with certain providers and managers and surgeons and physicians that were open to that. So when I would educate patients, they were very open to me teaching about nutrition and lifestyle management and all those other holistic approaches. And so they were open to it, but to an extent. And a lot of that goes into I think one, training. Two, there's not really a big understanding that there is evidence-based practices for holistic modalities. It's just not a very widely known factor information. And there are still things that are in the holistic world that don't have that scientific research, but we've been using for thousands of years as humans. So I think it's just having that open mind to be able to see it. But yeah, I'd say the majority of my coworkers and peers were not on the same page that I was. I think sometimes they thought I was like the woo-woo hippie nurse.
Yeah, yeah. Yeah, the standard nurse archetype in society is certainly a fascinating one. To keep
Yeah.
it kind. What and so what does the Holistic Nurses Association do? Like, do you get specifically hired by certain hospitals or something as like, oh, we want someone from there, or do you guys just share information amongst each other? Like, what is being a member of that entail?
A lot of it is information and education, and then supporting one another. So if we have certain situations, we can talk to each other. There is just constant, nonstop support. And like I said, education and information that they put out there. So a lot of it is finding that there are a bunch of us that all have the same mindset, and we know that we all want to help our patients as much as we can. And they give us the tools to be able to support the patients that we're taking care of in a holistic manner. So they're very up to date on, new findings, new research, new ways of doing things, new different modalities, so different treatments that we can use. But I'd say a good portion of it is education and support. They do have conventions. There's also, they also have chapters and chapter meetings where I was at. I think I was like the only one, so we didn't have a chapter where I was located. But yeah, there's just constant community support. It's just wonderful.
And so how does it work? Like say, you consult the Holistic Nurse Association, they let you know, oh, this might be a good idea, and you look into it, and it's like, oh, that might be a good idea for someone I'm working with. I don't really understand how, inter level hospital bureaucracy works. Like,
Mhm.
do you have the authority to then just go do that or does it have to be an approved something somewhere, or like do you have to run it by the doctor? Like how much freedom do you have to implement holistic modalities within a standard hospital setting?
That is an excellent question because it's all of it. It's all of it combined. So, as nurses, we have our own scope of practice. As a holistic nurse, we have our own scope of practice. But we also we have our own license that we practice under. But we have to follow the orders of the physician or the surgeon or the provider that we are working with that is taking care of that patient. So, whatever we're going to try to implement or would like to implement in a holistic manner, we do have to discuss with them and then get their agreement. Now, as far as a hospital setting, that's a whole nother level. There were, like I said, I was on a pain management committee. And so what we would have to do is we would come together as a group. We'd get our ideas together, what we wanted to implement into the hospital setting. But then we would have to go and take that to different boards, different committees, the presidents, and then also different, there were like different sections of the hospital that we'd also have to get signed off on too. So it could
That sounds
be,
nauseating
it
already.
is, it was very convoluted at times. There was one approach that we really wanted to implement. It's called battlefield acupuncture. They actually use it in the Army setting, and what it is it's a pain management. And they put acupressure, little gold pieces of acupressure points on your ear, and they stand for a certain amount of time, and it actually helps manage your pain. Well, because of not agreement on understanding of different or different perspectives on holistic management, we couldn't ever get that pushed through. That was just something that we couldn't get accomplished, and we tried. But like I said, there's all of the politics also involved in an organization like that. So you have to kind of, go within their lines too. We did use aromatherapy for a while, and it was extremely successful. Patients loved it. But something had happened, and it was unfortunate. Just, I think it was more of a perspective. And so we had to completely stop aromatherapy use for our patients. And it was like those living in, assisted living and hospice patients that were benefiting the most from it. And then, they're using it, and then you have to take it away. And it's like, so you have to still follow those lines. Like I said, I was blessed to be able to work with so many people that were very understanding, but there were also some that weren't. And I don't know, maybe it's just part of it is just a lack of education. I mean, truly. I did work with one physician that told me, I think they only had like 8 hours of nutrition in all of their medical training. So that physician was more than, welcome to be able to have me teach a lot of the patients, just even about nutrition practices. So like I said, we have to still follow within our own scope. We do work with our own licenses, but we also have to follow with what the physicians, the surgeons, and the providers are saying and ordering, and then also whatever organization you are a part of.
Yeah, that's I like myself. I couldn't do that. I would just be so mad. I can't stand that stupid shit.
Oh,
But yeah,
oh,
I just want to say I have had done that battlefield acupuncture
mm,
that you mentioned. I don't remember the guy's name, but he's down in the West Palm, Florida area.
yes.
I'm gonna put the name on the screen for anyone who's watching because he was amazing,
Oh,
and I very much recommend checking him out. He was such a kind and gentle man, and was very knowledgeable about what he did. And I felt results. I felt specific results. I had a couple things going on in my body at the time, and nowhere to do with the ear. And he knew where to place the things to make that area feel better. It was fascinating.
that is just
Um,
wonderful. Like just knowing you have a personal experience with that is just awesome. And you're right, it is extremely frustrating, especially when you know that one, there's something that's less invasive that you can do to help people.
yeah.
Two, it's not addictive. I mean, there's just so many simple things that you can do, and it gets very, very frustrating. That's why I left the healthcare field. I mean, I couldn't stay working in a situation like that, when I know
Yeah.
that there's so much more we can do for patients.
Yeah. Did you ever see? I mean, obviously, when a patient gets denied the wonderful healing modality that can
Mm.
help them in favor of some sort of petro drug or hack job surgery,
Ooh.
there's going to be suffering involved. But did you ever see someone like really maybe even suffer so much that they died, or like something that you knew would have been preventable with something that you recommended and it got rejected?
Um, I don't want to say that they died. There are people that suffered significant pain needlessly. I would actually have patients that would finally tell me, like, you know what, I'm using cannabis, and I'm just going to be upfront and honest with you. I'm not doing anything else that anybody else is recommending. This is what I'm using. This is what's helping me. This is what's keeping my sanity. I heard that repeatedly over 7 years. I mean, just repeatedly, mostly with people with neuropathic pain, and because that was one of the hardest ones to treat.
Yeah.
When I was in urology, I'd hear people saying the same thing. They'd have kidney stones and they'd be like, nope, I'm using cannabis. I don't need, opiates or whatever. But we did have a lot of education on, you know, even just not using opiates as much as as much as they could. And I think that if we would have been able to educate on different things that they would have been able to use or do, that there would have been a lot more pain relief. I mean, I'd have people call me on the phone daily and be like, "I'm in pain. I don't know what to do." Thankfully, like I said, I worked with certain providers that were accepting of me, giving them different information to be able to help manage their pain. But as far as, like them severely suffering it to the point where they weren't able to function, yeah, I did see some of that. And it was frustrating.
Yeah, and because that was my next question. Like where is the line of what you can and can't do, or does it get blurred sometimes? Do you have to pitch a modality to a patient, and then they say, "Oh, yes, I'd like to explore that." Then you go and try to get it approved, or do you have to get it approved through all the bureaucracy to even mention it to the person in the first place? Like, when can you even let the patient know that might, even if it doesn't get approved through the official avenue that you could administrate, they might be
Mhm.
able to seek something out on their own? Well, how does that work? When does the patient get to know about these things?
After we get the approval from those that we are working with. Yeah.
Yeah.
Yep. We have to always make sure that, like I said, the providers or the surgeons or the physicians are okay and on board with whatever we are discussing with the patients. You have a little bit more freedom in home health and hospice. And that was a little bit different, because you are on your own for the most part, and you are really trying to help them, get through significant things. But as far as like in the clinical setting and being within a hospital itself, you do have to get the approval of those who they're actually under the care of before you can even mention any of it.
I'm sure
Mhm.
you would never do this, but I imagine there might be, some wonderful instances of, a pamphlet falling out of someone's pocket that a patient might find.
Well, maybe. There
The
might have been a few instances.
no, no, you'd
No,
never.
just kidding.
And so in the other direction though, did you ever go for like a Hail Mary and like try to get something approved that you were like, there's no way they're gonna approve this, and it did get approved and you were able to help someone with it? Was there a good story like that?
That was the aromatherapy. Like we did not like expect that. I mean, and we fought for that for a long time. And when they said yes, it was like, oh my gosh, like really? Like we can use this? Like wow.
Like,
Like
wow, we didn't plan for this. We didn't think it
wow.
would work.
Yeah, like that was actually extremely shocking because aromatherapy affects your mood, which affects pain, which affects how you're feeling. Even just general malaise when you're just like not feeling very good. Even if you use certain aromas, it can actually help and uplift your mood. So when we were using that, it was like, oh my gosh, like this is so cool. I didn't think that we were going to actually ever get it approved. I mean, obviously, eventually we got it taken away, but what can you do? You can only do so much. And really a lot of it is just, I think it's people's perspectives. Again, it's a lack of education, a lack of knowledge, and a lack of understanding and how they are trained.
So why did it get taken away? Did the lavender oil kill someone, or did someone just get sick of smelling it? Like why? I don't understand. Why did it get taken away?
So it was on I think a piece of furniture, and I can't remember which one exactly it
It
was,
stained a
but
piece of furniture, and that was it. Damn,
yes.
that's
Yes,
rough.
that's actually how that one got. That's how they got rid of that one.
Because it stained a piece of furniture
Uh-huh.
while it was helping people.
Yeah.
Damn.
Yep. Yep.
And so for
I mean,
those,
it was just crazy because like people weren't using or asking for, like morphine or anything like that as much as they normally would when we were using the aromatherapy. Like there was a significant decrease in it. So, I mean, there's a correlation. It was helping these people, which then they didn't want us to use opioids either, So and then it goes away. It was just crazy. It was
I don't know. You,
crazy to
you think
me.
that was just an excuse? You think the stain on the furniture is an excuse? You think they maybe got a knock on the door like, hey, why aren't you buying all our opiates anymore?
I don't know. I don't know. They were the organization that I actually worked with. they were very do not prescribe opioids unless you absolutely have to. But there was a lot of prescribing of other medications that were not specifically formulated for pain. Um, I just, I still don't really understand a lot of the thinking. And I think that the person that decided to say, no more, we're not doing it anymore, just didn't like it and didn't agree with it and didn't agree with our thinking.
Yeah. And so, for
Mhm.
those who don't understand what we're even talking about, aromatherapy, can you give a description of what that even entails and what it is, and what are some common uses for it?
So, aromatherapy is basically essential oils that you can diffuse. You can combine with an oil, like coconut oil, jojoba oil. You can even use shea butter and kind of mix it into there. So, it's the fragrance of a plant. And so, the fragrance of the plant can do different things within the body, specifically the mind. And so, like lavender is extremely calming. It is extremely useful for sleep. If you're stressed and stressed out, you can just put a little bit of lavender oil even on your palms, on your chest, even on your hair. And just the properties of lavender actually change the chemistry in the body to be able to help relax you. Citruses are very uplifting. They're uplifting for the mood, they're energizing. So you can use it in the same way and it'll help that way. As far as the pain management, those are like different things like peppermint, eucalyptus, ginger, turmeric, frankincense, myrrh. They all have super huge properties that they can benefit the body at a cellular level. And so it literally helps affect the cells in your body to be able to work more efficiently like they're meant to in the first place.
Nice. And so, what considerations should someone give when choosing perhaps an aromatherapy device or choosing perhaps what essential oils to purchase?
Mhm.
Because to my knowledge, it's a very dirty game and a dirty industry, and I know that
Mhm.
there's lack of purity in some regards. I know there's essential oils out there that are rather synthetic in origination. What's the like? How do you look out for yourself and make sure that you're doing it right?
So you do have to make sure that the company that you're purchasing from is doing third party testing. And they also test for heavy metals. Those are two very big things. Also, when they test for pesticides. So when you're looking for an aromatherapy, company to purchase from or a brand, make sure that you have those three things in place. There are some that I have listed on my. I have a specific page that has like safe products, but they they do have all of those things in place, um, because you have to be careful. You don't want to be putting more toxins into your body. I mean, you're trying to get rid of all that stuff. You're trying to balance your body back out. Um, and you're right. There are very, very few companies that actually pass all three of those. Um, so there's doTERRA, there's Arakasha, and there's another one I can't remember at the top of my head right now. There's three of them that I do recommend to people because they do have all those three of those things in place. Um, I actually used aromatherapy as capsules when I was going through cancer and cancer treatment. And it was, for me, extremely beneficial. I did have to get approval from my healthcare provider. So before you ever use any aromatherapy or essential oils, do discuss that with your healthcare provider or your healthcare team. And then also you have to be really careful too, because you could have an allergy to any of it. I mean, it is a plant. So they do advise doing certain like skin testing. You can choose like a certain part on your hand or your wrist, and just get a little bit of coconut oil and just like a dab of the essential oil, and you can test it out and see if it's safe for you to use.
Yeah, I got a little aromatherapy machine actually the other day.
Nice, nice.
It
Oh
was
yeah,
$3.
sweet, sweet. Yeah, well, and that's the other thing. So diffusing. So here's another big thing with aromatherapy. So we've all gotten accustomed to air fresheners. plug-in air fresheners, right? So there are so many issues with those, like endocrine disruptors. I mean, just we add, irritants, toxics, that you're breathing in, all sorts of stuff. So using an air like a diffuser is a great replacement for those wall plugins. And I mean, plus you're getting the benefits from the oils itself. So you're kind of getting a 2-for-1.
Yeah, air fresheners are one of the things that piss me off the most. They genuinely irritate me. Like, can't you just breathe air? People are so unconscious to even how they feel. Like, you don't feel good when you breathe in chemical air. It's not nothing. They think that you just smell this chemical fragrance and it's not affecting anything because, oh, they wouldn't sell it if it was bad for you. And like,
Bingo.
you walk in, you have any sort of awareness of yourself, it just feels awful. It feels awful to the nose, awful to the mouth, awful on the skin, awful to your soul. Like, I can't stand it. And it's so insane how ingrained this stuff is with people, and they just don't think about it. The wall plugins, and you'll see that like eat away at the paint on the wall as it's as it's getting diffused, or like, yeah, you ever see someone like spill, like, if you spill one of those, it's like, it's nasty, it's caustic. It'll disintegrate a floor below it. And it's just so insane how unthinking people are. So I was somewhere the other day, I was trying to enjoy a family get together. My family does not have the mind like I do for health and wellness. His extended family, aunties and uncles and such.
Yeah.
And I'm sitting on the couch and I'm like, smell something. My hackles go up. I'm like, this ain't right.
Yeah.
And I see to my left, there's a machine, and it was strange. I've never seen such a machine. It was like a teardrop big machine thing. It had water in it. So like, okay, what's going on? It was diffusing into the air. Like, maybe there's hope. But the liquid in it was like a greenish blue tint. It wasn't quite water. So I'm like, let's investigate. So I go and I put my hand over. I'm like, okay, a little residue, a little oil. It's strange.
Yeah.
I smell it. I'm like, well, this isn't right. This is not. And so I asked, one of the people who live there, I'm like, hey, what is this? Like, what's in that water? You know what she said?
What was it?
Laundry detergent beads.
Oh my gosh.
What? Like, what?
Oh no. And that's a whole nother situation.
Laundry, geez. Exactly. Yeah. Laundry detergent beads are bad on your laundry.
Oh, yeah.
Horrible. Probably worse than general air fresheners. Now you're taking that and direct injecting it into the air.
And you're breathing it all in.
It's not even the poison that's designed to go in the air. And you're taking that and putting it in the air. Like, they didn't even think that through.
No.
Normally, I think they have this, testing that they do. And they're like, oh, well, we can't kill people too quickly. We have to make sure it kills them slowly. They didn't test this one. But you know where they found this? TikTok.
No.
Yeah. Is that we found it on TikTok.
Oh my gosh. It's insane.
It's just like, it infuriated me.
It's just insane. I just don't understand it. Well, I mean, there's so much indoctrination that, everything just has to smell good. Well, I mean, we have nature around us. Everything does not have to smell like a fragrance, but that's a whole other thing that the companies have like marketed to ingrain in people's brain, almost brainwashing them. Pretty much is what they do. Is saying, you have to have this fragrance so that you smell clean. Well, no, that doesn't mean that you're clean. It is
a complete washing of any sort of sense of anything, and it's just raw consumerism, and it's just stupid. It's insane. It's insane. And so I left that room and went over there and probably was inhaling some other bullshit that was over there. It's like, you can't trust people, and that's the thing. You really can't trust people. You can't go amongst people that aren't comprehending of these things, because like, people are just liabilities, because they put themselves at risk with their unconscious behaviors, and then you can't even be around them without subjecting yourself to poisons on different capacities. it's insane. I just want to stay home. I know my
I
house
know.
is clean.
Yeah, exactly. And what you're going to breathe into. Most people don't even realize that their migraines, their headaches, their asthma, or breathing problems is actually from the scents that they're all using. Like
Oh, you better
it
believe that
just,
whole family has chronic health issues.
oh, yeah, yeah, yeah.
100%.
100% you would. I mean,
100%.
like, if you're constantly I mean, how can your body even try to like continue to try to balance itself out if it's like trying to push, or defend itself from all those toxins constantly?
Yeah. And
I
then you
just,
say something about it, and they're like, "Ooh,
mhm,
no, not
yeah.
that bad."
Or it's like offensive. It's like, or
Yeah.
you're crazy. Like,
Yeah. Yeah.
you don't know what you're talking about,
I'm like, oh, really, really? Oh, that's nice. Oh, and then I'll just
Yeah.
anyway.
I know. You know
Ah,
what? One of my favorite things to do is like when you walk into somebody's house and they use essential oils on a regular basis, there's this huge, like, earthy smell. Reminds me of walking into a health food store. Oh my gosh. It's just like, it's heaven for me. Like, I just feel so at home. But yeah, like, well, I suffered even from chronic migraines for the longest time. So this last time when we moved, because I moved from the state of Wyoming to the state of Michigan, and this is when I was really starting to dig into a lot of beatcancer.org's education. And I was like, I'm not using these plugins anymore. Um, Lo and behold, my migraines that I had been suffering with for years completely went away.
oh, absolutely, absolutely.
Yeah.
When I lived with my mom, and I woke up to stuff like this. We had such a battle of she would put up a plug-in,
Mm-hmm.
I'd throw it out. She would take it out of the garbage, plug it back in. I'll throw it out. I'll throw it out in the outside garbage on trash day and make sure it's gone. She would buy another one.
Oh,
Like
I don't
like
know. What is the obsession with like having to have everything smell so perfectly good? Like, I
it's
just
not
don't
even
really
good.
understand it.
It's not even
Yeah,
good. It's like it's just chemical,
it
but people
is.
have so like they have this equation of like you were mentioning, like natural is bad and consumed fragrance and consumed product is good. It's insane. It's
Yeah.
genuine insanity.
Mm-hmm.
It's
Well,
crazy.
and once you get yourself away from all of it too, like you can't
That's
even hardly
true.
walk through like a laundry, like, so like what is it, the paper supply and like the laundry detergent aisles in the store, you can't even hardly walk through those because like you get an instant headache or you get nauseous or sick to your stomach. I mean, that should be a huge indication if you've completely taken yourself away from that, detox yourself from it, and then you go back around it. And you could be like aisles, away from it. You can still smell it. Like it's just like, and then the realization hits and you're like, oh my gosh, like all these people are putting this on their bodies, they're breathing it in, like rubbing it on their skin. It's
Yeah.
just
Yeah, I
yeah.
mean, to a fly that knows nothing but shit, honey
Uh-huh.
would be strange. Like, but whoa, what
Yeah.
is that? I don't like that.
Oh, yeah.
That's not what we do here. It's but yeah, once you two get out of it, and
Uh-huh.
you look back, it becomes so clear. But
It
when
really
you're
does.
deep in the woods, you see nothing but trees. Uh,
Mm-hmm.
it's fascinating.
It
But
is.
let's switch gears a little bit. And so you faced different health problems, related to the gut, and then ultimately resulting in cancer.
Mm-hmm.
What do you think is the reason or reasons why you faced those things?
Oh, that's like a big topic. Oh, we could talk hours about that one. So, part of it, one is I have celiac disease, so I'm predisposed to that. And so, what celiac disease is, there's these little things in your digestive tract. They're kind of like little fingers, and the proteins cut them off, so you cannot really fully absorb nutrients. So then your body goes into malabsorption, which then throws everything off. So cancer has an opportunity to grow. So that was part of it. But also, I had a lot of trauma and stress in my life that I had never addressed or dealt with. I was living in stressful situations that were very, very toxic in causing a lot of health issues. Two, my diet was constantly processed foods. And this is partly because I did live in poverty. So even though I grew up in a family that taught me holistic ways of eating and living, I thought because I was poor that I could not do those things. When in reality, if I look back and I'm like, oh my gosh, if I would just ate more vegetables and fruits, and it would have been cheaper too, instead of trying to afford all of these processed foods, but they made it seem like processed foods are a lot more cost effective than eating healthy. So there was that part of it too. Um, Again, like I had lived around a bunch of scents. At that point in time, I was using, candles and air diffusers and all of that other stuff. Um, I was not in a great state of mind. I had a lot of depression and anxiety, again, related to the trauma. So I do know that that was part of it too. I was not drinking enough water. Like I probably maybe had one glass of actual water a day. Maybe there were some days that I didn't even really hardly drink it. When I was growing up, I loved water. I'd prefer that over anything. But then as I got older, it was like coffee, nonstop coffee or energy drinks. So then again, you're putting your body into a more stressed state. So yeah, there were all these things. I wasn't exercising. I wasn't moving my body. So it was just like the perfect storm, honestly. And when you think about it, most people are actually in that same situation. Majority of Americans live that American lifestyle. And I 100% know that that was what led to the cancer itself. I walked in at my 5-year appointment. I was given a 20% chance of survival after 5 years because the cancer that I had was so aggressive. My oncologist looks at me and he goes, I was extremely shocked to see your name on the schedule. I thought that there was a mistake. When he walked in, he was like, I can't believe you're still here. Like, what are you doing? And I told him I changed my diet. I changed my lifestyle. I started dealing with the trauma in my life and the stress in my life and the anxiety. I learned coping mechanisms, meditation, mindfulness. Like I said, I started drinking a ton of water. I think I was drinking a gallon of water a day, which was probably one of the biggest things for me. Oh, and my sleep was off before too. So I was sleeping better. And I was getting myself out of situations that were just extremely toxic. So he's like, well, just whatever you're doing, keep doing it. Like, don't stop. And I'm still here 9 years later.
Wow. Wow,
Mhm.
that's amazing. And so, of course, it's not obligatory, but would you like to share, the nature of the trauma that you were facing that ended up resulting in this ailment in the body? Because, a lot of people
Mhm.
might be finding themselves in different kinds of suffering and downplay it and not necessarily realize that it's that exact kind of unresolved trauma that can be this serious. Would you like to share anything
Oh
that
yeah, no, I
happened?
don't mind at all. Because I found the more that I address things and the more that I speak up about it, I realize that there are way more people dealing with things that you would never expect. And they sit there and say, thank you for sharing that. I'm very open about what had happened in my life. So I grew up in a very strict Christian household. Um, my biological father, I am now estranged from, is a diagnosed sociopath. And so I was the scapegoat. I was a scapegoat. And then it also didn't help that I am autistic and have ADHD. So I did not fit into this form of, who I was supposed to be as a person. So even from the very first stages of my life, I was trying to conform myself into somebody that I wasn't. So that's a lot of psychological trauma. He then had gone on to molest my older sister. Um, and because they are so good at manipulating and estranging family members from certain situations and manipulating the context or stories, they cause a lot of psychological damage and a lot of dysfunction and separation between families and family members. So, here I am growing up as this kid. I was really, I appeared shy because I'm autistic. So I felt like I couldn't really speak about any of my emotions. Definitely could not talk about what happened in my family. That's still something most of my family members will not talk about or discuss. Um, and so I started to internalize all of it. When I started realizing how bad that situation really was is when I started getting sicker because I wanted to talk about it with everybody. I wanted to talk about it with people. And I just couldn't. And so you take those emotions and it gets stored in your body in all sorts of different places. And so the less that you deal with those things, the more likely you're going to suffer from a chronic illness. And suppressed emotions are a huge part, I believe, of cancer and what causes cancer. And so I had then, grown up in a dysfunctional family and trying to figure out my way around things. I eventually did get pregnant as a teenager. I had 2 children before the age of 19. Their father, my ex-husband, was an alcoholic and a drug addict and not very responsible, obviously. So I had a lot to deal with at at a very, very young age. So then you add on malabsorption and all the other things that I was dealing with. And it was just a big mess. And so I suppressed and repressed a lot of what I was internally going through. And when you can't talk about it, you just feel like your voice is lost. Then you start to hold bitterness, resentment, anger, all of those things. And that's not healthy for you either. I mean, your body is supposed to live in coherence with everything else. And if you're constantly pushing things away and not dealing with anything, there's going to be an imbalance constantly. So those were my biggest things that I was dealing with. I had eventually still continued to get into toxic relationships because I did not know how to manage or deal with anything. And it wasn't until I was going to counseling most of my life. But it wasn't until I found one counselor that was able to truly address things. I finally did EMDR. I used ketamine therapy. I learned how to truly meditate, not just affirmations, but meditation. I learned to stand up for myself and have boundaries. I never had boundaries. I was the biggest people pleaser and walk all over me. You could do or say whatever you wanted to me. I'll just put up with it because I just want to keep the peace. There was a lot of lack of worth and self-confidence from all of that. And so once you're healing from a very narcissistic situation, you start to realize that there's things that you don't have to accept, you don't have to tolerate, you don't have to put up with, and it's okay to remove yourself from those things. And once you do, the weight that has been holding you down for so long is just lifted. It's like, oh my gosh, I can breathe. So yeah, that was probably the biggest part of it. There's still some of the things obviously that I have to deal with. I did lose my older sister. She did become a textbook case of sexual abuse. And so she tried to live a normal life as long as she could. But she did eventually go on the path of addiction. We were both fighting for our lives, unfortunately, at the same time. She got diagnosed with pulmonary hypertension while I was diagnosed with cancer. So my poor mom, I felt so bad for her, but she had a perspective of this is her way out. Her illness and her disease was her way out. They call it medical suicide. And 100% believe that that's what she did. And for me now, it took a little bit while, for me to get over the grief and stuff. But I just realized that she's now with not having to suffer through the memories that she has every day, so that part was, coming to that understanding was a bit freeing. Well, not a bit freeing. It was extremely freeing. And so I think that people have so much of this that happened in their lives and they don't talk about it. I mean, because it's a taboo subject. You just don't talk about those things. And victim blaming is a huge thing. People would rather push everything under the rug, act like it didn't happen, and then deal with it and then face it and then actually have to deal with the repercussions of everything that happened.
Yeah. Wow. Thank you for sharing that. Because of course, stories like this are far too common. And yeah, there's a strange phenomena that goes on with the victim blaming, and then even that gets co-opted and kind of used as a term when it's not necessarily appropriate, when it's so much craziness that's going on. And it's such a very unfortunate thing that so many
Mhm.
people are suffering through these types of scenarios. And it's
Yeah.
only through education and allowing these conversations to happen, and allowing them to be out there, that they might resonate with someone, and someone might be able to recognize the cycle or the pattern that they're falling into. And I really
Mhm.
think that that helps break people out of falling down those pitfalls of what often happens after unfortunate circumstances. And that's the beautiful thing about today. With all the craziness that we have going on, it's so beautiful that you and I are able to have this conversation.
Mhm.
We're in different locations, we're from different backgrounds, we have different experiences, and we can learn together and spread this
Mhm.
message that might resonate with people, and be
Yeah.
there to help someone. So thank you for being willing to share that. Thank you for doing your part to break the cycle within yourself and to figure it all out. Because even just figuring it out within oneself, what happened to me? Why do I feel the way I
Mhm.
feel? What's like going on inside of me?
Yes.
Is a whole task in itself that not a
Mhm.
lot of people, or not enough people, I'd say, ever really try, and then not ever
Yes.
really accomplish. But then go on and be able to articulate it is a whole other feat. So I do
Mhm.
commend you,
Thanks.
and thank you for being willing to share that. But I want to dive into
Like,
something a little different.
mhm.
Uh, at the beginning of that, there you, and it's not the first time I've heard you in our conversations, identified with the monikers of ADHD and autism, and I'm curious what that means to you. Like, what makes you Marinette with ADHD and autism versus I'm just Marinette and this is how I am.
So for the longest time, I mean, I honestly didn't ever put a label on it. I just knew that I was just different from people. I was very quiet and shy. I appeared that way, but really, what I was doing was I was observing. Like, I watched the world around me. I was always interested in deeper connections and conversations. I was not very deep into, and I'm still not. Like small talk and stuff. I just would prefer not to. I get very overstimulated very easily, especially by sound, people, and then also touch. And as far as the ADHD, I get super hyper focused on situations, which I've always done my whole life, almost to the point where it's like obsessive. uh, Health and healing and personal growth, that's my hypervigilance. That's my one thing that I hyper focus on, and I have for a very long time. And like just certain stimming. We can like hold our hands differently. We sleep differently. Just those kinds of things. But the more research that I'm doing, I'm finding that there's like phospholipid issues. There's gut issues that actually cause the exacerbation from those. There's certain things that happen in vitro when you're developing between the mother and the baby. That can also exacerbate the tendencies to have ADHD and autism or autism. So, like I said, for the longest time, I just thought I was kind of weird. Like, I just thought I was a weird person. I mean, I looked like I was normal on the outside, but like once you got to know me, you're like, people are like, oh my gosh, this chick's weird. Like, I was telling my husband the other night, like we were watching some like shows from the 80s. I can't even remember what it was. Like, oh, it was like the A-Team. Like, that was what I wanted to watch as a girl. Like, I didn't really want to do a whole lot of girly things. I'd rather watch like Star Trek and like, Star Wars and, do those kinds of things. Play outside with the boys, go play baseball. A lot of those things are just, we think, I don't want to say in a different way, but I want to say that it's more of a focus that we get. And, my son tries to explain it to me that we see it as a bigger picture. We're always seeing the bigger picture of everything. So that's why we have to find out the why. Like, it's a constant curiosity, I guess is probably the best way to put it. The ADHD, executive functioning, I am like all over the place and squirrel. But like I said, a lot of that can be nutritional and gut imbalances. So, like I said, I always thought that I was just a different person. I just thought I was just me. I was just weird. And it wasn't until, oh geez, I wouldn't say I was 37 before I even was diagnosed. So it was because I was in an environment where it was high stress, and I was trying to work as a nurse, and I'm like making small mistakes that I shouldn't have ever made, or like not even mistakes, but like just overlooking things, specifically like in an email or typing something. And so I thought that I always had to be like a super person, super woman, super nurse. So when I went and saw one of my providers, she's like, yeah, I think this is what you're dealing with. And she was just totally along the lines of, your diet, your sleep can hugely affect it. So yeah, I just, yeah.
Yeah, and so my philosophy on it is I just can't stand the terms. And
Yes.
with that said, understand that there's a lot of levels again to this going on, like there is with all things. There is
Mm-hmm.
very much the real debilitations that someone can have, and I do think they are with cause. Nothing's
Mm-hmm.
random, and I don't think
Mm-hmm.
defective individuals are just created, right? Uh, ADHD, I think, is often the result of poison, physical, or emotional, even. And, like things
Mm-hmm.
that can happen to you or be input into your body in different capacities, diet or otherwise, then make it difficult to focus because you got all this stuff going on in you.
Exactly.
There's also the autism, which, yeah, I mean, it's just toxins. It's just toxic buildup and toxic overload and immune system damage through the
Mm-hmm.
various immunological poisons that we have in us, around us, and etc. And the problem is, although that's real,
Mm-hmm.
it ends for a lot of people at I have this, she has that, he has that, instead of looking at, oh, this person's experiencing these symptoms that get described as these labels. What can
Mm-hmm.
we do to mitigate and or reverse those things from happening? The labels end up being
Exactly.
the box that people put themselves in or put others in, and then they just stay there their whole life because they're like, ah,
Mm-hmm.
I'm just in this box. That's why I always challenge the use of these labels as self-descriptors, because I think it's a lot more harmful. But then there's a lot more, that there's a even further layer going on where these things are weaponized.
Mm-hmm.
If a child doesn't want to focus for 8 hours a day on some bullshit schoolwork, they're
Yep.
not ADHD, they're a human child.
Exactly.
If someone doesn't like stupid robotic small talk of the
Mm-hmm.
average everyday world that's completely meaningless, they're not autistic, they're just a real person, and everyone else is a bot. Like, based on your description, I'm ADHD, I'm autistic. Like, no, like it's they're weaponized terms at this point.
They really
And
are.
then
And
those
it's
labels get used to put people on drugs and
mm-hmm.
to make them feel wrong. And so that's why when I see someone who's a very high functioning person, clearly, and I'm not saying that you're without your challenges, but
Mm-hmm.
I always challenge to stop identifying with these things because you're just Marinette. And if the
Yeah.
crazy world thinks you're weird, so be it. I think the world's weird. You know?
That's so good that you bring that up, because I actually had that epiphany like a couple weeks ago. I was listening to a meditation. I was doing a meditation by Dr. Joe Dispenza, and he says, in the meditations, become no one. You're nothing. You're just you. Like you're just you. And once you have that realization, you're just like, oh my gosh, these are just man-made terms that they put
Yeah.
to try to like group us into, and it's more like division. It's like, oh, well, you're weird. You're not like the normal people. Well, maybe part of it is we're not indoctrinated. Maybe part of it is we can see outside of that indoctrination. Maybe part of it is we can have that critical thinking, that can actually see outside the bullshit, because a lot of us are bullshit detectors. We just are. We're blunt, we're honest, and we call things as they are. But that's just who we are as people. And you're 100% right. They do use it as a label. And here's the medication, and here's this. Well, when you start digging into it, you're right. It's toxic buildup. It's environment. It's emotional. It's all of it to combine together. But I do think that they use it as a way to continue to divide everyone. Like
Yeah.
I 100% agree.
It's
Hmm.
division, it's distraction, it's drugging.
Yes.
It's all the above. And it's you say we bullshit people. I think a lot of times it gets used to bullshit ourselves too.
Oh,
I
that's
think
a
a
good
lot.
one.
I think a lot of people, perhaps you may have found yourself doing this at times,
Hmm.
might not do something the way that would be ideal, or the way that they would have liked to have performed at whatever level, and then chalk it up to, oops, it's my ADHD.
Hmm.
Oops, it's my autism.
Yeah.
Like it's a dispelling of responsibility in a lot of ways for
Ex-
not achieving to the degree that we'd like to.
Well, and it's like a lack of accountability.
Yeah.
So some people use it as just a total lack of accountability. Well, I'm sorry, there's still things that you need to fix and figure out. I mean, we're still part of, a community. We're still part of society. You got to still take accountability and try to fix things. I mean, it's kind of like anybody with a chronic illness where they are like just constantly dwelling in on that chronic illness, and that's almost becomes their identification. Well, if you're not going to really do anything about it, you can't that's not taking any accountability to change anything, you
Exactly.
know?
And then conversations like this get called hateful. But meanwhile, what we are trying to do, and what I'm trying to do, I'll speak for myself, is empower people to understand that it
Yeah.
doesn't have to be this way. You don't have to just chalk a label on and then excuse the negative or less than ideal scenarios. There is something to be done to make it more optimal. That can
Hmm.
be done. There's always a way. The people trying to
Always.
put you in that box and keep you in that box and have you keep yourself in that box, they're the enemy
Yep.
while they coddle
100%.
you.
100%. Well, and I was just reading a study this morning. I can't cite it exactly. Like I was talking about the liposomal deficiency. I mean, that's like huge. If your body is like not getting enough lipids and all those, like the fats and stuff, and able to, use them like they're supposed to, of course you're going to have dysfunction in your body and in your cells and in your brain. I mean, that's just the way it is. So like, yeah, a lot of it when you start really diving into it, it is lifestyle. It is taking accountability for your own actions. It's taking like using coping mechanisms. I mean, we're just living in a human life. But here's the other thing. I'm so glad you actually brought this up. So we live in a society now where we're like stuck inside, right? So we're on our computers, which you and I, we have our businesses where we're on our computers most of the day. That's what we do for a living. But we're inside or we're on our phones or we're on screens, whatever. We have this huge disconnect from nature now. Like we were never intended as humans to have the lifestyle that we do right now.
Yeah.
We were meant to be outside. We were meant to be one with nature. We were meant to eat like the earth, like, an earth diet. We weren't meant to be living in stressful situations, stuck in a classroom for 8, 9 hours a day. Oh, and then you have to go to activities on top of that. Oh, and then you have homework on top of that. I mean, it's just constant stress. And we were never meant to be that way. I read an interesting book too that was talking about how people that are like ADHD autistic, really, it's because we are disconnected from nature. Like we are just disconnected. Again, food, but even on our environment. Because most people, they call it green therapy, which green therapy is just being out in nature. So green therapy is extremely beneficial for
Uh,
ADHD and autism. Well, yeah, I mean, you're going to ground your vibration in your body is going to be like neutralized from all of the constant stress and the negative vibrations. It's just there's so much to it, and it blows my mind that, like you said, they try to make it as a weapon. They weaponize it. I mean, try to divide, try to keep people on medications, try to medicate everybody. Because I mean, part of it is a business, right? They're trying to make money off of all the medications that they're selling. So why would you tell people for free you can go walk outside, spend 15 minutes outside, or go watch the sunrise, and you're going to get all of those benefits, especially your circadian rhythm will be going back into place. Like, why would you do that if they're not going to make any money off of it?
yeah. I mean, there's the money element to it, but I think it's far more sinister than that. I think it goes beyond that into esoteric reasons. And I think
Ooh.
there is just genuine evil in this world that wants the people of the world to suffer. And when you genuinely wrap your head around that as a possibility, well,
Uh-huh.
suddenly things start to make sense where they don't otherwise.
That
It's
is so interesting.
I
You are
think it
so
goes
right, though.
yeah, it goes far beyond money. They print money,
Uh-huh. Yeah,
but money isn't anything. The people
true.
orchestrating these engineering of society, they print money. It's
Uh-huh.
not real.
And no.
So it's not about that. They have everyone else chasing the money. They make the money. So they don't need money through these things.
Mm,
It's far more than money. Yeah, I think
power and control.
it's power and control. And I think there's just a genuine evil in this world that want
Mhm.
suffering and pain and they feed off it like parasites. And
I agree 100%. They,
100%
they call it, well, are you familiar with colonization? What?
colonization.
Colonization.
Yeah.
Yeah. So how, I mean, it's basically the indoctrination of everything that we're living right now and how we're living right now. And, basically it is their power and control. So that they can rule over everybody else. And we are just like minions. I mean, I kind of think of it as the minions. We're just doing their work for them. We're just constantly doing their work for them, and then keeping us in that state so that we don't become aware of what's going on around us or what's happening.
Oh, 100%.
Yeah.
There's always been a war going on between good and evil, and the war has gone quiet, although some places it is
Mm.
quite loud and evident and in your face. A
Hmm.
lot of it's quiet, and infiltration and subversion is a lot easier than going in guns a-blazing a lot of the times. And that's what's been
Hmm.
done. There's been an infiltration and a subversion to every single system of humanity: education,
100%.
law, politics, medicine. It's
Hmm.
infiltrated and subverted. The media, it's all the same.
Yeah.
And when you start to connect the dots, it's very fascinating how they all lead back to a similar direction. It's
Hmm.
and pointing it out gets you, thrown in jail. And but it's time to just be a thorn in the side of this beast that's been created and silently taken all of humanity in the grasp. And it's
Hmm.
there's nothing to do anymore other than just like you have to point it out. And ultimately,
Yeah.
that's really all it takes. Darkness cannot exist in the presence of light.
Hmm.
All you must do is shine light upon the darkness, and it is no more. And
Hmm.
that's why the people saying these things and pointing these out and noticing the patterns and noticing the connections, they're the demonized people beyond reproach.
Oh yeah, 100%, and censored. And you're shamed. It's almost like you're shamed into even seeing truth. I mean, really, that's what ends up happening. And it's not even just on, it's even on a small micro level, even between friends, family, and coworkers. I mean, you speak out and it's like, oh my gosh, like, who is this person? Who do they think they are? And,
Yeah.
and you're really just trying to be a light to the world. Like, honestly, you're
It-
just trying to help other people.
it's Agent Smith.
Yes, it's Agent
It's
Smith.
Agent Smith. That's it.
Hmm.
The majority of the populace are just Agent Smiths. And you might
Yep.
think that's your mother. You might think that's your brother. You might think that's your neighbor. You might think that's your, I don't know, stranger in the grocery store.
Yep.
But they have been trained at a subconscious and
Mhm.
unconscious level to, if you step out of line, to
Yep.
bash you back into place, to defend the system that has just been coercing and co-opting everyone into existing within it so they could enslave everybody.
We literally are in the Matrix.
Literally in the Matrix.
Literally.
And that's the thing. When you understand what's going on and who these people are, you
Hmm.
understand the concept of karmic retribution. This is very important to them. They tell you what they are doing.
Hmm. Oh, it's
If
not
I
hidden.
Exactly. It's not. It's not.
Uh-uh.
Maybe behind like a little bit, maybe the print is a little smaller, but it's there.
Hmm.
And if you don't read it, that's on you. If I
Yep.
give you a poison apple and don't tell you, and you eat it and you die, that's on me.
Hmm.
But if I say, here, Marinette, here's a poison apple, you eat that poison apple, you die. I
Yep.
didn't do that. You killed yourself. I just offered you this apple and
That is
told you.
probably a perfect analogy. Like, honestly, that is so how it is. It
It
really
is.
is.
It is. And when you study Satanism and you study these people's philosophies, you understand
Hmm.
that's exactly what they're doing in all regards.
Yep.
Everything's out there, everything's available. They might make it a little convoluted and difficult to find the information, but it is always out there.
Mm-hmm.
The ingredients lists are right there. Then they make it convoluted with, like we were talking about on our Beat Cancer call yesterday, oh, well, red 40, people are waking up to that. Let's call it Azure Red or whatever they call it now. They might make it a couple layers of difficult, but you can still find that information. You
Mm-hmm.
can still read the public information patents for the weather modification and blocking out the sun technology, spraying aluminum and
Yes.
barium into the sky. But like, that's public information. You can
Mm-hmm.
find it.
Yeah.
You
It's
can
right
still
there.
exactly. And what they don't tell you in public information patents and outright in the ingredients list and things like that in a hard way, they tell you in media.
Mm-hmm.
They tell you in movies. They tell you in TV shows. They show you what they're doing as they're doing it before they do it. They program it into your subconscious so you accept the craziness years ahead of time. And then they let you know, even after they've done it, what they've done to you, while you laugh at their movies
Mm-hmm.
and think it's not reality. But it is.
It
It is.
really is. And you're so right. Like I didn't even actually think about the putting it in front of other people or putting it in front of people first and then rolling it out because then they're already like accepting of it. That's just mind blowing. Like absolutely mind blowing. And we as a society, we just go along with it. And the other thing is too, is they make it hard to find sometimes, well, not hard, but they make it more difficult to dig through all the information.
They certainly
And
don't spoon feed it. Yeah.
no,
They'll
no.
spoon feed you TikTok dances while, and make it a little more difficult to find real health information. That's how the world
Mm-hmm.
goes. But,
100%. I mean,
but
honestly, I got to think about it this way too. Like it took me, okay, I've been 9 years cancer free. It's taken me almost 9 years to find beatcancer.org. And it's been around for how long?
like almost 50.
Exactly. Why, when I'm searching for holistic approaches, did it not ever come up in any of my Google searches? Why didn't it ever come up in any of my Edge searches? Why was it not there? If it's already been there for, that long, why was it so difficult to find?
Oh, we get heavily censored. We get
Yeah.
heavily, heavily censored, especially within the last handful of years.
Mm-hmm.
We went from like tens of thousands of hits on our website a month to suddenly when they had their favorite, product that they were trying to inject into everyone and everyone was waking it up and searching for good health
Oh.
information. Suddenly around that time, our Google traffic dropped dramatically.
Wow.
Every week we get videos deleted off YouTube.
That's amazing.
Videos from years ago. Videos that are citing studies.
So how are they saying that they can
They're peer-reviewed studies. I don't give a shit about peer-reviewed studies. They're all garbage, right?
Yeah.
And I say that, of course, with the nuance. Some are real. There are some. Most are garbage. Some are real. Follow the money. Figure out who's paying for the researchers, and you can do your own due diligence. Always run things through your intuition. But the point is, we have information. Everything on Beat Cancer is citing studies within the official avenues. They're not, these abstract third-party studies. It's like PubMed. It's the peers, the glamorous peers have reviewed these studies. And we specifically get that information cited as why we get our videos taken down.
So do they say that they cite, like it's because of the information, even though have the facts?
So YouTube, when they delete a video, they give you a timestamp. Oh, this is getting deleted because of the information at second 26 of the video. And I go to second 26 of the video, and it's saying, according to this study by this and this and this person in Japan, apricot seeds can be good and beneficial, blah, blah, blah. Yeah. That happened.
Wow. But they're going to let everything else on there that's benefiting certain people.
Yeah, of course. Opiates and drag queens and,
and all that other stuff.
Perverse stuff. Yeah, that can stay. That can stay.
That's amazing. That is just, it's amazing. Well, it kind of like reminds me of, I know this is, I don't know if this is going to be a different topic for you that you've really not dug into. So I've really started digging into Native American history, Indigenous American history.
Yep.
And it's all right there. This is the perfect example. It's all right there in front of us. But they've done such a good job hiding the truth that it's almost impossible to find. So the only way that people are really getting information on all of it is because of TikTok.
Yeah.
Like literally everything else is blocked. If you try to even search it, even on like DuckDuckGo or Brave, it's extremely hard to find.
Yep.
So, I mean, it's just like, so that's truth. So, I mean, what are they going to do to you? Like, what are they going to do and hide from you? It just is mind blowing to me. It really is.
Yeah.
It's been kind of frustrating too, like going into the holistic field and going like, oh yeah, gung ho, like I'm gonna finally be able to really help people. And you're like, oh my gosh, everything I get on there to try to promote my business or market or whatever is censored, or you're blocked, or you're shadow banned, or it's deleted. And you're just like, why? And you cite things and like you pull up the information like with the facts. I had one that was deleted and it said this was fact checked and it's not actually found factual. And I had to go and send them the study, multiple studies, to say, no, this is fact. Sorry, you don't agree with it, but this is fact. Yeah, no.
They don't care. It's not an approved fact. That's it. That there's wrong think and there's wrong fact.
Mm-hmm.
That's the truth. And to touch on the Native American culture thing, it's real because these people that are societally manipulating everything and everyone, they hate all cultures that aren't their own. It's not just against Native American. It's not just against these people, that people. They hate all cultures, and they hate people being connected to their ancestry, and they hate people having a strong sense of pride in where they come from and who they come from, because that protects people.
Yes.
And that gives people a reason to live, and that gives people a community to exist amongst, and that gives people knowledge of how it used to be.
Yes.
That's why they destroy all cultures, because they want everyone just being this conglomerated mush mess of modernism and be completely blind and forgotten to where they came from. Because if you forget where you've come from as a people and as humanity, suddenly where we are doesn't look so bad. They get to pull this illusion over everyone that we're the most advanced it's ever been, and this is as good as it's ever been, and look at all this great things that we're doing, not realizing that it's all just artificial and synthetic and completely co-opted and subverted and inverted version of reality and of humanity, in contrast to the beauty that was yesteryear. They can't do that unless they make you forget. And they can't do that unless they disconnect you from your roots. That's why they want everyone just mixed in and conglomerated and forgetting their ancestry and their heritage. It's not just Native American. It's Native everywhere.
Everything.
Everybody.
Yes. Yes, it is 100%. And if you think about it, I mean, like you said, your community, if you separate families and continue to separate families, you're going to drive people to be easier brainwashed into whatever you want them to think. Because they're not going to have the outside perspectives from the other people, or they're not going to have the wisdom from the elders, or they're not going to have, all of these things from the community that you would have normally been in to be able to help protect you from them in the first place.
Yep. And it's very fascinating how the people orchestrating this above, at the highest level, they do quite the opposite. They stay very much amongst their community. They very much keep people out of their areas of occupancy. It's very fascinating how it's for thee and not for me. Very fascinating.
100%. Yeah, 100%. I mean, they do. And if you're not part of their family, you're not part of their social circle, you're nobody, you're nothing. So it's okay for them, but not for us. And it just kind of reminds me of, so Rockefeller, he was one of the big ones into the pharmaceutical industry, right? It's starting here in America. So he bought a pharmaceutical company in Germany, and he did not really use allopathic medicine. He's continued to use holistic medicine.
Yeah.
Yeah. Let's think about this one. Yes. I mean, like, you're 100% right. As long as it's like, do as I say, not as I do. Do as I say, not as I do.
100%. Because what I say is inherently and objectively, and I know it while I'm saying it, harmful.
Yes.
I'm not going to do it.
Yeah, 100%. Nope. And we go against the grain. That's okay.
I want to check in with you with time, because I'm having a great time. And
me too.
I do have some time to go over. How are you doing on time?
Oh, I'm good too. I don't have anything else planned. I'm just going to make tamales later.
Nice. All right. Well, we'll keep going until we feel like getting off then. Because I want to
Yeah,
talk a
no, this
little
is
bit.
such a good conversation.
It is. I want to talk a little bit more about beat cancer, of course. So when the
Okay.
cracks in the dam of censorship were wide enough where you did find us, what was your experience with coming across beat cancer and being introduced to the programs in the community, and how did you enjoy going through the educational course there?
I could like I'm gonna cry because I felt like I was at home.
Oh,
It was like every answer I'd been searching for almost a decade. And so yeah, like I just was like I was relieved too because I'm like, holy shit, I don't have to do this on my own anymore. Like I don't have to spend hours researching on my own. Like I don't have to try to like dig into everything and then trying to make sure that the information that I'm finding is correct or it's actually accurate or, like trying to find the right functional medicine doctor or naturopath. Like I didn't have to like keep doing it on my own and it was just relieving. And I know a lot of people actually probably that come across it too probably feel that same experience, especially those of us that have gone through cancer. We're like, oh my gosh, like where has this been? So like when I started going through the program though, I thought I knew things. Like I thought I knew my stuff and I thought I knew holistic health and I really had no idea. And I had all this training as a nurse and I worked already as a nurse for 6 years and plus all the research that I'd done the rest of my life. And I'm like, there's like this whole other world out there. But then I have to tell you, I got actually pretty angry. I got pissed off because I'm sitting here thinking, and I told my husband this. Um, they are purposely keeping this information from people. People are needlessly suffering. People are needlessly having a terrible quality of life, needlessly going through treatments that are probably not going to benefit them. Um, and losing their lives. And that was frustrating to have that realization that why is this not a, you know, widely known thing? Why is this information not given to everyone? I mean, it was so that part was a little bit frustrating. But then when I started going through all of the coursework, I was just like, I was excited. I was excited. Oh my gosh, I'm going to implement this. And I know what this is going to do for this, like, especially like carrot juice. I actually had a family member dealing with some prostate issues and being able to tell them like, hey, juice some carrots. Like this is the information. This is the scientific, you know, studies and stuff behind it. And that person was so relieved. Like, you mean I can just juice carrots? Like I can just juice carrots and that's going to help me. And I was just like, yeah. So like when I started going through some of that information, I just wanted to know more. I started like super just really getting into it and digging into it. I think that's all I did for like a couple of weeks was read and listen and read and listen. Because I wanted to absorb as much as I could. But then it was like my eyes were open to this whole other world. Like there's all these other people out there that have this greater understanding of how our bodies work and how holistic modalities can help us survive, help us live, help us to live better lives, and not even just through cancer, but with anything, honestly. And then I felt like had like a sense of community. You know what I mean? Like sometimes you feel very alone, especially if you're on a holistic path for healing, for yourself and for others. And as a cancer patient, you really do feel alone. And finally, it was like, I'm not. Like I have support. Like I have people behind me. I have people to tell me what I need to do if I have a question. I'm not having to figure it out all on my own anymore. And as a cancer patient, that is extremely, extremely relieving because, like I said, a lot of times we feel alone, we feel isolated. And knowing that there has been this organization out there for 47 years, and that you can rely on that information and that the woman, Susan, that founded the whole organization in the first place, oh my gosh, she's my champion. Like she's amazing. Like she took that personal mission, something that was extremely painful for her, but she set out to help other people and help their lives. And even just hearing her story was extremely powerful and moving.
Yeah, absolutely, absolutely. And in that way, we honor Susan and we honor her husband and his passing is not in vain. And for those who aren't familiar, who might be listening, our founder of beatcancer.org, Susan, her story is that her husband got cancer. And to keep it short, he went the conventional avenues. She got to watch how that essentially sucked the life out of him until it killed him. When
Mhm.
he died, he didn't have any cancer in his body, even. So, by the statistics, the chemo and the radiation worked. But while it killed the cancer out of him, it just killed him, period.
Mhm.
And so, using that experience and watching that happen, she started to educate herself on the alternatives or the real solutions to health and the real way that the body works and the real way that the body heals and the real reasons that the body experiences ailments such as cancer. And,
Mhm.
I'll always say that we're a cancer centric organization, but we're a health organization. We're a health education organization because cancer is inherently just on the spectrum of health or sickness. And cancer has so many comorbidities with other ailments because it's the same things that will keep us healthy and cancer free or healing from cancer that will assist us in not experiencing other labels of different ailments and diseases, all the same. And the same things that will bring us towards cancer in different regards and in different areas of our body, well, you better believe those are things that are just generally bad for health.
Yes.
And so, it was one of our cancer coaches that said to me, we all have cancer every day. Cancer is just us having unhealthiness in our body, unhealthy cells in our body, which is a natural part of life. It's the natural cycle of our cells. But we need to make sure that we are in our everyday life adding to our health instead of putting ourselves into a deficit because our body can take so much and our body can take so much buildup of toxins in different regards, whether that be physical or emotional tucked away energy that turns toxic, but it
Mhm.
can only take so much. And that's why our everyday behaviors and our everyday lifestyle choices are what we need to be considering if we wish to keep ourselves in a state of cancer free, which
Mhm.
just means healthy,
Yes.
because those things are what add up and add up and add up over time. And all those things that you might think that you're doing, and you might think, well, I do this and I know it should be bad for me, but I'm fine. Well, at some point, cancer comes a knocking.
Sure does.
Then you might be able to get away with it for a while, but when you address these things at the get-go and don't have those things build up within you, you're being in a much better scenario. That's just facts. And so that's why I always say we're a cancer organization, but we're a health organization because we'll help people be healthy,
Mhm.
cancer free, healthy. It's the same thing. And so when did you decide to get involved with beatcancer.org? And did you originally intend to become a coach yourself, or were you strictly just taking it from the patient perspective?
Oh, that's such a good question. So I was actually working at home health and hospice, and this was probably 5 or 6 years ago. And I had a coworker, and she is just so sweet and so kind and so thoughtful. And she gave me a book called Radical Remission.
Nice.
And I dug into that book. I remember like getting halfway through it and just looking up and staring at my husband and going, I can't believe people don't know about this. Like, I cannot understand like why people like I've got to do something. Like, I have to do something. I can't just sit back and have this information and not spread it and not spread awareness. And so that's what really ignited me to wanting to become a coach. And then, time went by and I still continued to just live life. And I was still doing allopathic medicine myself for the most part. I mean, I did have some holistic modalities that I was doing, but I still was using a lot of allopathic. And then I just really started digging even more because, like, in that book, there's a bunch of different resources, and you can start following all the different doctors and oncologists in that book. So I had started following them, and I started reading all their articles, their research articles, and things that they had written. And so I started going down that journey. Then I was like becoming a whole holistic nurse, and then I had gotten involved in another coaching program. This was 2 years ago. And it was a gal that just helps balance hormones and helps women get into shape and feel their best. And I'm like, if she can do this, I can totally do this. Like, and I started searching for cancer coaches. Here's what's crazy. Saying again that this organization has been around for 47 years. I could only find 3 cancer coaches. 3. That was it. So I'm sitting here going, oh my gosh, like there's this huge need for it. I mean, if you think about all the people that have cancer or have gone through cancer or have had family members that have gone through cancer and they're trying to prevent it, there's like this huge population that's not being taken care of or cared for. So I saw it as an opportunity, like, okay, I need to be able to share this information with people. It's extremely important. This is, life-giving information. And so like I said, I saw this gal do it, and then I started digging into the coaching world. I had no idea that there was a coaching world, like no idea. So then I started following other people. I got off a little bit on a track of at first I wanted to just do nurse coaching. Well, then I found out I could actually do cancer coaching. That was through beatcancer.org. So it took me 2 years from when I decided to truly become, a course going or a coach and in developing a course and that kind of thing, to finding you guys. Like it took me that long. But that's eventually what I wanted to do. I remember telling my husband, and part of it too is because I did conventional treatment, I suffered a lot of side effects. And I didn't do conventional treatment for a short amount of time. I did it for 6 months, almost exactly 6 months. And I have a lot of missing body parts because I had cancer extensively. So I was starting to get to the point where it was hard for me to work in a conventional setting anyways. And so I'm like, you know what? This is my life's purpose. This is what I want to do. People need this. People need this information. People need this education. And he's been all on board with me, going into the coaching and whatnot. And so, it's just this huge passion. Like it just becomes your life's purpose, I actually even have like a little saying that is on my mirror, and it says pretty much that the knowledge that you have that you don't share with other people that can benefit them is actually stealing from them. So I remind myself every day, if I am not out there spreading the word, who knows who could have used that information? Who knows that, what would have happened if they would have had that information? It just breaks my heart when I hear constantly, and I'm in an area where there's a lot of cancer where I moved to, this person passing away from cancer and that person passing away from cancer. And it's not just older people, there's younger people like in their 20s, early 20s. And so it just puts this driving force in you that you just can't stop. I mean, it just becomes a part of who you are.
Yep, absolutely. And so what percentage of your work these days is as a cancer coach? I forget. You're actively working with people already, or you recently went through the training, or remind me where you're at in your specific cancer coaching journey.
So I am just starting out. I got the certification in, I want to say January or December. But since I moved literally across the country, my life was in an upheaval anyway. So it took me a little bit of time to be able to get things established. So I am working with a couple of people now. I'm not really, super involved with it yet, but I think as time's going to go by, it's obviously going to build up. And it always takes a little bit of time for people to get to know what you're doing. I find actually I have to explain what it is that I do to people because they have no idea what a cancer coach is. They have no idea what holistic living is. And so a lot of times I feel like I'm explaining that whole thing. But like now, and even just sharing the information with my family members and friends that have other health ailments, like it's just awesome. Like it feels so good to be able to tell people. But yeah, currently I'm taking clients. I'm just doing one-on-one coaching right now at this time. And eventually I'm going to be rolling out a holistic, just a basics holistic lifestyle course, just as an introduction to the beatcancer.org courses. So that way people that are not very familiar with what holistic living is and holistic approaches are, don't get completely just like bam in your face. This is all what it is. They have a slow approach or a slow introduction to it. So that way it's not so overwhelming for them. Because I know I talk to some people and they're like, well, if I'm gonna have to do that for the rest of my life, I really don't want to do it. I mean, there's so many things, like I said, again, we've been brainwashed into thinking that is normal. Like eating junk food every day is just a normal thing, eating highly ultra processed food is just a normal thing. Having the plugins in your house is just a normal thing. So when you try to explain that to people, some of them just are not very accepting at first to it.
Well, yeah, but at the same time that that's happened, having a headache every day is just a normal thing. Not being able to
Exactly.
sleep is just a normal thing. Having a runny nose all the time is just a normal thing. It's funny how that works.
It is. It is. So what's the normal? What's really the normal that we should be having,
Yeah,
So
there's been a strong deviation between what is normal and what is natural.
exactly. Exactly. So yeah. And I just I get on the calls each week and I'm like, I think I know my stuff. And then I hear other coaches talk that have been doing this for a few years. And I'm like, oh my gosh, I got to go do some more research. I got some more books I got to read because I need to figure some things out. But really, I mean, I have the basics. So that's really what we need to be teaching people is just the basic things. And then getting into, the more extended experience is always a good thing too. But
Oh,
yeah.
absolutely. And just a quick aside for those listening who want to know what calls we're talking about, every Thursday at 7 p.m. Eastern Standard Time, our beatcancer.org community get on a totally free call to discuss all things holistic cancer healing and prevention, but also all things holistic health and wellness at large. And that's totally free to join. It's a Zoom meeting. It's super easy. Go to beatcancer.org and click on the weekly call button right at the top, and that'll get you a link to join the Zoom. Anybody at all is welcome to participate, welcome to just listen in. You can be on cam, you could be on mic and ask questions and participate in the conversation. You can put your questions right on the chat. And, we welcome all people to just bring all things that you might have on your mind, and we will discuss them and get to the bottom of whatever's going on and figure out and find and share resources. It's a very wonderful call. And like Marinette is saying, there's always such fascinating topics that we cover, but we'd love to see some more people on there. And then right after we have that call, we also have another call that's exclusively for our community of certified holistic cancer coaches. And then this way we can have communications about holistic cancer coaching, and we can support each other in our business endeavors and discuss business resources and tools and help each other get our businesses in that way up. So those are the weekly calls that we're talking about. And so Marinette, what has been your experience on these weekly calls beyond just talking about some cool stuff? Like how have you been enjoying the evolution that you've been seeing? Because you joined at a fascinating time where we started to make rapid changes in the organization and improvements and renovations. How have you been enjoying seeing beatcancer.org evolving in the time that you've been here?
Oh my
Maybe.
gosh, it's been so wonderful. It really is. And it's becoming more accessible to people on different platforms too, which is absolutely, it's great because I mean, different people are on different things, right? But this amount of support that you guys provide us, it's incredible. I mean, you guys do so much. I mean, you provide the coaching calls, you provide the holistic cancer coaching calls too. Plus, you guys send us out emails all the time. Plus you send out videos from other past interviews that you've done with coaches. Plus, there's a podcast. Oh my gosh, the podcast. Like that is just amazing. So you have all these tools available for us. And then, the fact that we can go back into our trainings and just refresh on things, that has been really nice, especially how you've been able to pretty much group it all together so we don't have to go to different parts of the website. It's all grouped up into one area that we all log into now. And it makes things a lot easier and smoother for us to be able to access. And it's easy to read. It's easy to manage and go through. It's not a mess. It's very streamlined, I guess is what I was trying to say. And so it's nice to be able to just have everything in one place. But yeah, like the support that you provide for us and the encouragement, that's the other thing, is you guys encourage us so much. And it's not even just, between you and Carl, but also through the other coaches. They're just extremely supportive in other people's growth. And that's the other thing too, because we have a Telegram group where all of us get together and we share information and whatnot and questions, and seeing the excitement between each of the coaches and sharing the information is empowering. It really is. And the other thing is too, seeing other coaches that have been where you're at, where you're just starting out, and seeing where they've gotten to, it gives you a lot of hope. Like, oh my gosh, we can do this. We can help people. We can totally get this. So yeah, like it's been just really, really nice. I like that my feed on my social medias is just starting to pop up with tons of beat cancer stuff. Cause like I said, there's so much information. Like I think I know things and then I'm like, oh my gosh, like I need to go look that up, or I need to go learn about that now, or I need to go check out that coach, So it's really empowering and it's great.
Yeah, and thank you for touching on that aspect of it, because the community element to beatcancer.org is such an essential one. The key word that you use to describe your cancer, experience before finding beatcancer.org was isolation. And that is such a common thread amongst people experiencing sickness and experiencing cancer. It's a very isolating time. You have chaos within and all the emotions that you're experiencing. You have chaos of, your family thinking a certain thing and saying things, or your friends or your loved ones, or everyone just goes a little crazy when, you have this thing that's been, made to be so scary in cancer. Then you get your doctors that might be pressuring and saying certain things that might not be resonating with what you feel is right, but you don't know you have any other options, and you don't have the mental energy or the time or the anything to look into what else to do. And, we as humans, we're not meant to be isolated. We're meant to be amongst a community. And especially in today's age where people already feel so isolated, communities are so disenfranchised and dismantled. Family units are so disenfranchised and dismantled. People feel alone on an everyday basis, even when they are their baseline level of healthiness. And then you add cancer on top of it, and it's incredibly, incredibly lonely and isolating of an experience. And that's why I always emphasize that, when someone joins beatcancer.org as community, through one of our educational programs, through, hopping on the weekly calls, you really are joining a community. That's such an important part of it, and such an important part of the healing, and such an important part of the empowerment, because it's not just about the information that we talk about. The information's great, but having the people that are on that same wavelength of trying to heal ourselves and help ourselves and live naturally. Suddenly you're not the crazy person that wants to do aromatherapy and eat, vegetables and clean foods. Suddenly it's validation when you've only known that you're weird in this weird world. And it really changes people's lives to find their tribe. And more, that's what we intend to be here at beatcancer.org. For those that are seeking information, seeking health, seeking natural existence, seeking just good people, that's what we are here at beatcancer.org. Whether you take one of our educational programs as a patient, a caregiver, or as someone that wishes to be a certified holistic cancer coach, or you just join us on our weekly calls, or you just engage with us on social media, we want to find our tribe and expand our tribe of people that just have good information because we are only as good as our people. Our staff is quite small. Our course ends where it ends currently. We do intend to add more modules and add far more lessons to it. But far beyond what we, the staff of Beat Cancer, know, our coaches, our community members, our participants in the weekly calls know far more. And in this way, we all bring something to the table, whether it's just a little piece of perspective, a little piece of knowledge or expertise or information. And from that, we all grow. And this goes to the coaching side as well. Just like it can be lonely and frustrating as a cancer patient, being a holistic healer or a coach in any capacity trying to help people is also a lonely endeavor for far too many people. And so that's why I always let our coaches know when you're a coach certified with our program, you're not alone. Like Marinette was saying, we get together every single week as coaches and discuss what we have going on. What are we facing? What challenges? What do we, need to work on? How can we improve our businesses and improve our mental health to keep ourselves in proper working order to continue to help people? Because that's a challenge in itself. But also, we have people to celebrate our wins with. It's my favorite thing to open the calls with, all right, who had a good week? Who's, who did something new? Who tried something? We celebrate each other's wins and we can all, virtually at least high five each other and really, just exist in that positive energy and that keeps us all going. And then beyond the week, beyond the weekly call, that Telegram chat is so cool. I love when I see our coaches utilizing that Telegram chat because then that's essentially 24/7 community, 24/7 access to toss something in the group chat of like, hey, here's this cool article I found. Hey, what do you guys think of this product? Hey, I've never heard of this phrase or this term or this type of cancer, and someone has probably heard of it. And then this way we could all figure things out together. And the unfortunate truth is that there's so many cancer patients in the world, and that number is only increasing as this world becomes more artificial. That we as holistic cancer coaches, our hundreds that we have certified all around the world, it's not even like we're in competition. We're doing the same thing, and it's more so like we're on the same team. And that's why it's so easy for our holistic cancer coaches to collaborate with clients and not necessarily feel like we're combating each other, because it really feels like you can't throw a stone without hitting 4 cancer patients. Like it's not good. And so there's so much business to go around. There's so many people to help. And that's why it's a super friendly and easy environment for our certified holistic cancer coaches to work together and grow each other's businesses through collaboration. So I really do thank you, Marinette, for taking part in these programs that we've been creating and refining and continuing to evolve here at beatcancer.org, because it is through the participation of coaches like yourself that we are able to keep doing these things and that we are able to grow. And I would only just love to see these numbers go up and love to see more people coming around to the weekly calls and love to see more coaches being created and joining us. And so I'm just going to keep talking about us and getting us out there until we see the numbers that we should be seeing.
Same. Oh, could you imagine if we had like tens of thousands of coaches, or even like 1 million coaches? I mean, that would just be amazing. I mean, I have very high expectations. I have very high goals.
Yeah.
If we could reach out and just keep growing, so that we can keep helping people. I mean, it's just so, I don't even really have words for it, because it would be so beneficial and impactful to so many people, to so many people.
Absolutely, absolutely. And it's so important to remember the ripple effect that, this organization and every one of our coaches will each individually have impacts beyond that which they'll ever know. When a
Mm-hmm.
coach works with one person and educates even one person, that person now has a life and has friends and has a community of their own that are at the very least going to observe, wow, this person didn't die when their doctors told them they were going to die. What did you do? And suddenly now they're presenting information. They might go on to have children that they wouldn't have otherwise have because they died from cancer or died from cancer treatments.
Mm-hmm.
Now that's a whole generation that exists in a bloodline because of our cancer coach helping someone. Now that child is more likely going to be raised with healthy habits instilled within them. That's what they're growing up within. And see, the ripple effect is so incomprehensible, really, of how much impact even but one of our certified holistic cancer coaches can have on the world at large through helping people at an individual level, through empowering clients, through education. We're not here to just tell people what to do and have them do it. We're here to change lifestyles and heal. And a healed person behaves differently in the world and operates differently in the world and is more likely to sow peace amongst society instead of chaos, and more likely to experience peace and harmony that is good health internally rather than the chaos that is ailment and disease and cancer. And so, that's really how the world becomes a different and a better place, by impacting people at a one-to-one level. And it's it really is fighting the good fight.
Mm-hmm.
There's, whether we chalk it up to financial gain or we chalk it up to something more nefarious than that, there's certainly something going on, and some people or organizations that have a vested interest in sickness. And they work together
100%.
very well and very systematically. So the more organized and the more together as a community we become, as those on the side of health and wellness and goodness, the faster we see changes in the world that we need to see. Because the world cannot continue to go on the way that it's going on. Humanity cannot exist for much longer like this. It's
No.
not looking good. But through the tools like becancer.org and through podcasting and then through the TikTok that gets used to spread good things. And, we are the media now.
We are.
We can spread our message. And so, I do ask that anyone that's listening to this message and resonates with it and understands what we're doing here, please, you have the power to contribute, if not by becoming a coach yourself, just by sharing. Send this conversation to a friend. Follow us on beatcancer.org social media channels. Share that content around. Show up on our weekly calls. Let people know about our weekly calls. If you have come across someone or do come across someone that might be facing cancer, let them know that we exist. We're not necessarily here to sell anything. We have free programs that we offer to help cancer patients. If they want to take our course and empower themselves through the education that way, that's wonderful. But I am very happy when someone takes advantage of the abundance of free programs that we offer. Remember that we at beatcancer.org are a charity. We're a nonprofit organization. And as a nonprofit organization, we have an abundance of free educational outlets to take advantage of for anyone in the world, whether they are experiencing cancer, know someone that is, or just want to empower themselves with the preventative information that we offer. We have a naturopathic doctor that we offer counseling with, personalized counseling one-on-one for absolutely free. We have blog posts that someone could spend hours and days reading through. We have social media content where people can get snippets of information. We have weekly calls where someone can participate in conversation and get personalized information. And then we have our educational courses that we do sell in order to keep the wheels on the bus and fund all the free programs. That's what allows us to complete all of these free educational programs and offer them for free, because it takes money to exist. It takes money to get these things done and to get these things out there. And so we do, of course, appreciate when people empower themselves with the education through our educational courses and participate in that way, because then it continues to give back to us getting those free programs out there. We also offer an affiliate program. If anyone would like to help us out by spreading the message about our courses, and sales of the course result in the way from you spreading that message, you can earn an income off that as well. So there's plenty of ways to get involved and to help us out. Even if you yourself don't wish to become a certified holistic cancer coach with our educational programs, there's a lot of ways that if you like our messaging and you like our mission and you'd like to help us out, you can help us out. So for any inquiries on that regard, you can, of course, always go to beatcancer.org and click around. I've tried to make it easy to navigate our website, but you can also just reach out to me personally at zfrank@beatcancer.org. That's ZFRANK at beatcancer.org. And I'd be glad to point you to any area of our organization that you wish to explore. So Marinette, where can people find more of you if they'd like to work with you in any capacity? Please let the people know where they can connect with you on socials or your website or your business. Who should give you a call? Who should contact you? And how would they do that?
So I work with cancer patients, whether they've been diagnosed today or they were diagnosed decades ago, and still dealing with side effects and wanting to prevent cancer from recurring. And so what you can do is you can visit my website at reallifeincancer.com. And there's some information on there about what I do and the services that I provide. And then there is also, as you scroll down the website webpage, there's also a place to be able to book a free consultation with me. So I do provide that free consult with me. And we go over quite a bit. We go over your medical history. We go over certain life histories. And there's a form that you'd have to fill out. And then, I review that. And then I personalize the consult to be specifically for you on that first time that we meet. And then you can also find me at Facebook, Instagram, and TikTok at reallifeincancer.com.
Wonderful. Wonderful. And Marinette, is there any final closing thoughts that you'd really like to leave off with and ingrain in the minds of our listeners?
I just want to let people know that there is always hope, no matter what your circumstances might look like, no matter what your circumstances might have been in the past, there's always hope. There is always something that can be done. There's always a silver lining in every situation. And so just remembering too, that sometimes when it seems very dark and grim, there are always ways that, that the light can shine through. And you can turn those things that are not so great into your life and turn them around for good and help other people. And so I hope that you can take my story. I hope you can take the information that I provided to you and apply it to your life and find some help in it. But the biggest thing is just don't give up. I mean, there's always, some way out there to be able to help you. Oh, and I did need to actually just correct that. So on my Instagrams or my socials, it's Real Life in Cancer on Facebook, Instagram, and TikTok.
Awesome. Marinette, thank you very much for the work that you're doing in the world. Thank you very much for participating as a coach with Beat Cancer. And thank you very much for coming on the show.
You're welcome. Thank you so much for having me.
A big thank you goes to Marinette for coming on the show. She's a super cool woman with a lot of very good knowledge and information and a great way of conveying it as well. Very enjoyable conversation, and it was an honor to have her on the show, truly. It's also an honor to have her as one of our certified holistic cancer coaches over at beatcancer.org. For those who aren't familiar, I run the charity organization beatcancer.org along with my business partner, Carl. And we are a 47-year-old nonprofit organization here in the United States that educates people on holistic ways of preventing or healing their bodies from cancer. We do this through a variety of free programs we offer, such as one-on-one personalized counseling with our in-house naturopathic doctor, free weekly group session calls Thursdays at 7 p.m. Eastern Standard Time, free articles on our website via our blog section, and an abundance of social media posts on every social media platform you could imagine. We love giving out educational information on as many different fronts as we can for absolutely free. And in order to fund the free programs, we also sell educational courses as well and use the proceeds to fund everything else that we do at the organization. The courses are designed to be helpful to anybody and everybody, whether you're a cancer patient, caregiver or family member of a patient, a medical professional, a holistic healing practitioner, someone that just loves to learn, or someone that would like to build a business or add an additional service onto your existing business of holistic cancer coaching. We have 3 levels of the course, each of them being cumulative and building upon the last. If you take Tier 3, which is the course in its entirety, that is our Holistic Cancer Coach Certification Program. Upon passing the final exam at the end of Tier 3, you then receive your certification from us as a holistic cancer coach. And it doesn't just stop there. At that point, you receive ongoing business resources and support from myself, from Carl, and from our team and network of individuals with assorted business specialties. We do anything that we can to help you succeed in spreading the information that we want to get out there in order to succeed on our mission of educating the public on holistic cancer, health, healing, and prevention. Marinette is a wonderful example of what it means to be a certified holistic cancer coach with beatcancer.org. But it doesn't just stop there, of course. We have hundreds of other holistic cancer coaches all around the world. And this is one of the most exciting programs that we have over at Beat Cancer, because the more coaches we have, the more people can ultimately get the help that they need on a day-to-day basis. It also grows our community. At beatcancer.org, we're not just a website, we are a community. And the community programs that we have, such as the public weekly calls, the coaches only weekly calls, the coaches only Telegram group, and others, are some of the most fun things that we have. Because if you like the discussion that me and Marinette had today, you'd love the conversations we have on our weekly calls. There's a lot of very interesting things going on in the world these days, and a lot of them can be very harmful to our health. And so over at beatcancer.org, we're growing a community of like-minded individuals that want to get to the bottom of what's going on out there and what's going on in our bodies and how we can live good and healthy lives. So if you're someone that likes to talk about the things that you might have heard on this podcast or other matters of holistic health and wellness in a free speech valuing community, we'd love to see you over at beatcancer.org. Whether you hop on our open to the public free weekly calls or dive deeper with us by joining our holistic cancer coaching community, we'd love to see you be a part of our team. We need to stick together in these times. Us people that value holistic health and wellness and just want to take care of ourselves and our families, we're all on the same team. And beatcancer.org welcomes differing philosophies. We welcome respectful disagreements, and we love to explore topics from different angles and different perspectives. We're not a one-size-fits-all organization. We understand that there's nuance and different circumstances to health, and we just want to have open and honest discourse about all things health and healing. Again, a big thank you to Marinette for coming on the show, for being a holistic cancer coach with Beat Cancer, and thank you to everyone for listening. You're listening to the Health King's Court. Ancient wisdom, modern health.